Hi everyone, welcome to Talking Live with Macy. Same drill, we'll wait for 15 people before we begin. I hope there are more people joining, not just from NCSM, from our survivors groups, but a lot of people out there, the public, because we want people to know more about cancer, especially in Malaysia and Asia. There's so much to talk about today. So we have three people already. Let's share this video, help us raise awareness about cancer in conjunction with World Cancer Day. We have we're waiting for 15, just 15 people, then we can begin. So guys, please share this with your friends, with your family, get them to come in, tune in, and find out more because we have such an apt person to answer all of your questions about cancer globally. So please, now we have 15 people already, it looks like. So we're going to officially begin. Hi, everyone. Welcome to Talking Live with Macy. Thank you so much for joining us here on your Sunday afternoon. We would like to encourage you to share this video right now with your friends, with your family who are staying home and being safe, because this is a much needed topic to be shared. We're going to raise cancer awareness. Just by sharing this video, you can help us raise cancer awareness. And today's topic is actually in conjunction with World Cancer Day 2021, which just happened on February 4th. It's such a big deal when it comes to World Cancer Day because people then try to raise awareness, not just in Malaysia, but globally. And this is a global initiative to tackle cancer and to talk about it and not be afraid to talk about it. So let me go through a few of the statistics with you about cancer globally. First of all, cancer is the fourth leading cause of death globally. And within Malaysia itself, 43,000 over people developed cancer in the year 2018. And in terms of the incidence rates, we have the most common cancer being breast in Malaysia, followed by colorectal, then lung. So these three are the top when it comes to cancer in Malaysia. So we have so much to talk about. I know you have questions. What are the treatment options available? That's one of them. What is the the incidence of cancer in Malaysia, the status of cancer? How do we prevent it? All these are very relevant questions, and we should be asking them. We should educate people about it so that people are aware. They can detect it early and also hopefully prevent it. And also because Chinese New Year is coming, I will be giving away this butter cookies to three lucky winners at the end of today's session. You just need to stay with us. And answer a question that I'm going to pose. And then three lucky winners will be winning this for Chinese New Year because this is in collaboration with Lush Bowl. They are healthy eats. This is handmade. So please stay with us. Start asking your questions now because we can pick them up after that and and there will not be any backlog. So everyone, just for your information, we have it. It's very difficult to get Dr. Murali to join us. He's a very, very busy man. I'm so happy that he could join us. He's the managing director of the National Cancer Society Malaysia, and he's so nice to spend his Sunday afternoon with all of us, answering my question and your question. So I'm going to officially begin to ask Dr. Murali the questions that I have. Then you can also start typing in your questions. All right, guys, please start doing them right now. So, hi, Dr. Murali. Thank you so much for joining us.
Hi, good afternoon. Of course, thank you so much, Maisie, for having me on. It's always a pleasure, and it's a pleasure to see everyone as well.
It's so good to have you, and I'm glad that we didn't have so much issues like the last time. So, my first question for you is, what does World Cancer Day stand for?
Okay, so World Cancer Day is really like a global idea, and the whole idea behind having a special day where you kind of commemorate cancer is just like your birthday. So every day is theoretically just another normal day. So it's just because of your birthday, then you get cake, people come around, people give you presents. So it's always good to have a special day when you can get presents. But similarly, so World Cancer Day is really a day that we've all decided to come together and really pay a little bit more attention to cancer. And on that day, there's just a lot more awareness, and hopefully a stronger message gets to go out to a lot more people who would otherwise not be, so aware of what's going on in terms of cancer. Yep. So it's an opportunity to shout out, really.
Thanks a lot, Dr. Murali, for sharing that with us. And for those of you who are tuning in right now, please share this with your friends, with your family. Help us raise cancer awareness. So share this video now so they can watch it live and ask questions. Now, my second question for Dr. Murali is in terms of cancer awareness in Malaysia as a country. How do you think we have fared?
Okay, so unfortunately, and I'm sure we've, I think, talked about this to death. Um, do we have more cancers than other people? Are Malaysians that special? No, we're not that special actually. So we've got about the same amount of cancer as everyone else. It's just that we've got different cancers. For example, like in Australia or something, you get very high amounts of skin cancer, but you don't see that. Luckily, the brown and yellow peoples, we're a little more kind of not as sensitive to skin cancer because of pigmentation and all that. However, we get a lot of other different cancers, like I think you were mentioning earlier about breast cancer and so on. So what is different, and this is where I think it's very tied into what you were saying about awareness, is our cancers get picked up late. So our people are
Yes.
not peka, they are peka. So peka in the sense that we are not sensitive to the signs and symptoms that may signal that we're having cancer, one. And then second is for a lot of people who they do sense these changes, these abnormalities, these signs, symptoms, whatever, they actually just kind of attribute it to everything else. That causes big delays, and really that's what the problem is in terms of awareness. The need of people to like come faster when they realize that something's going on.
That's so true. Like I know a lot of people who put off getting screened because they say, oh, I could just be having this because I'm heaty. In Cantonese, it's called yit hay,
Yes.
or
Yes.
like there are so many other reasons. It could be, let's say, if it's prolonged constipation.
Yep.
People just think, oh, I'm stressed out. All
Yep.
these things, these are signs, signals for all of you, but no one picks it up. And then
Yep.
when you go to the doctor, when it's detected, it's already stage 3 and 4. And by
Yep.
that time, the treatment becomes more difficult. So, yeah, guys, we need to be aware, we need to be informed and educated. So that leads me to my next question. What are the programs that are being activated in conjunction with World Cancer Day?
Okay.
In
So
terms of NCSM.
okay. Oh, in terms of NCSM, yeah. Okay, I'll tell you about what everyone else is doing, and then I'll tell you a little bit about what we're doing as well. So I think one of the strong signals that has come out from World Cancer Day is, a look, and this is from evidence coming out from all over the world. What we're finding out is that a lot of cancer patients or people who are suspicious that they might have cancer are actually staying away from hospitals because they're scared they'll get COVID. Now, COVID will kill you this week, but cancer will kill you next week. It's the kind of message that's gone out on World Cancer Day. So as much as we are at risk to get COVID, I think there's also a very high risk that if you're suspicious that something is wrong, don't wait. Don't be afraid of going into hospitals. So you need to go in, you need to get checked, and that's been something that is a consistent message that everyone's putting out. Now, that's kind of the big picture. So don't wait, don't be afraid. There are a lot of kind of steps or protections already in place in hospital to allow you to go and continue being safe. So what is this? Please go in. So that's kind of the big message. Now, in terms of what NCSM is doing, we are, I think, kind of understanding that this is the issue. We still do not want to, of course, bring a halt to like testing, diagnostics, and all that. So if you notice, we've put in a few measures. What we're trying to do is we've gone to a 7-day week now, so that we can stagger out our patients. People who are working on certain other days, they can come in on Saturdays or on Sundays and get screened. And then, of course, instead of we've always been very welcoming in the sense that you can walk in at any time. Now we're being a bit more careful, just afraid of the overload. So we're saying, look, kind of trying to put in appointments so that you can stagger the number of people coming in. So those are the kind of things that we're trying to do. But as well, we have also embarked on two big programs. I think one is our at-home program. So we're having a program where those who want to get screened, you can actually get in touch with us. We'll come do it in your house. So that's something. So we're getting our nursing colleagues to actually go out, and I'm very proud. Perhaps this is the first venue in which I'm actually announcing this ahead of time in Ibo, but we're actually coming up with something called 4K. The 4K program is, and you'll hear more about it in the coming weeks, is about community kawal cancer kebangsaan, which is basically the national cancer control community. What we're doing is we're getting partners, clinics all over Malaysia to kind of take up similar screening programs as us and offer them in their clinics. So rather than the need for you to come up to like NCSM or something, you can actually get it done in places near your house. So that it's easier for you to travel, and it's nationwide as well. So that's something that's going to be rolling out within the next couple of weeks. We also now some of our testing we're trying to do as post to your house. So one of the programs, I think we have a new. We're working together with another group of people, and we've actually deployed the thing called the GYN pad to detect cervical cancer.
Yes.
Yep, and that's something that we are able now to post to your house. You can do it in your house and then post it back to us, and then we can give you the results. So we're going to try that for colorectal cancer as well in March. So basically, I mean, I'm sorry to speak the French, but yeah, so it'll be a program of send us your shit. And, from your own toilet. So we're going to try all these kind of things to, get people to continue getting screened and staying safe within the confine of their own homes. Yep. So
That's
yeah,
great.
these are the things that we are going to be doing.
All these initiatives are so good. You can do screening from your own home, and it's provided by not just NCSM. NCSM is working with clinics around Malaysia. So that's very, very good news. Guys, I hope you're taking more notice and note of what Dr. Murali is saying. So the next question, Dr. Murali, is what do you think Malaysians lack in terms of cancer awareness?
Oh, okay. So the lack is, I think, in terms of personalization. We've always got this mentality that, look, this can never happen to me. I am immortal. It'll happen on the neighbor, it'll happen on the auntie across the road. It'll happen to my grandmother's second cousin's third wife, but it'll never happen to me. So that the lack of personalization, the idea that I could be at risk for cancer is something that we still haven't quite crossed. So people are aware of cancer, they know that cancer kills you. People know about breast cancer, but they won't do anything about it for themselves. So I think so that's the kind of little bridge that we need to cross, though. So we're
Yes,
hopefully getting there as well.
I think that's much needed. A lot of people think that it won't happen to them, but we never know. So
Yep.
I would like to ask: is cancer increasing in Malaysia?
Um, it is, but and I'll tell you why. It's not because we have extra radiation now or something, but it's really because one, we're picking up a lot of cancers. And that's really actually due to awareness. A lot more people are becoming more aware, and that's a good thing. And second thing is, and this is really a very existential problem in the sense that people are living a lot longer. So I always joke about this. I said the reason why cancer is high is because now you can live past heart attacks. So, and so it's a good thing or a bad thing, like, in the sense that last time you would get a heart attack at 50, not be able to stand, and then you would pass on, and that'll be the end. Now, you get a first heart attack, you get a second heart attack, you get a third heart attack. Somebody puts you on all these various stents, and that enables you to live much, much longer. So, and as we all know, cancer is much more a disease of the late 50s, largely. So that's why you start seeing like a lot of numbers in terms of cancer. Now, having said that, okay, having said that, there has to be another point that I have to raise while I'm on this track, which is you are quite right in the sense that there's a lot more younger cancers now. And that is really because of exposure. And what do I mean by that? Okay. Now, we know that cancer takes about 18, 20 years of exposure. All these are averages. Sometimes some people it happens a lot more closer, a lot more acute exposure and all that. So we know that if you're exposed to say smoke, either you're a smoker or you've been smoking for a couple of years, you need about 15, 16 years for you to actually kind of generally pick up cancer. Now, what we are seeing is in terms of food, your processed meats, especially, yeah, and a lot of meat. All these are things that we are now exposing kids or even ourselves at a very young age. So, for example, I mean, and I'm sure if you talk to your parents, they'll tell you the same thing. You used to get chicken or pork or beef once a week. We couldn't afford it, right? Nowadays, you get pork or beef or chicken 2 times a day, man. I know people who eat like at breakfast, they're already having like a huge amount of meat already. So, and processed meat as well as just raw red meat is just something that has become readily available. So people are taking a lot more of it, and they're taking it from very small ages, and so which is why over that 20 years, suddenly in their early 30s, you're starting to see cancer. So
I
that's
see.
something we need to address in our younger children as well. So, and equivalently, secondhand smoke. I think we've had a couple of discussions on this, on how secondhand smoke in apartments, condos, these are things that children are getting exposed to. So your neighbor smokes above the balcony, so your house is smoke free, but your neighbor smokes on the balcony above every day, and his wife would beat him if he smokes at home, so he'll smoke on the balcony outside, right? And that floats down to you. Your child is exposed for say 10, 12 years. Of course, you're going to pick up lung cancer at some point. So
I see.
there's a lot of things that we are kind of not aware lah. So a lot of younger cancers lah because of this.
Okay, no wonder my Young Cancer Survivors group membership or whatever you call it is growing.
Yeah.
It's sad. So now my next question is, how does NCSM provide support for cancer patients and survivors?
Okay, so we can spend the rest of the day on this. Okay, but so a few large pockets of work that we do. The first is, of course, in terms of accommodation. Okay, so in terms of accommodation, we provide accommodation for cancer patients traveling from all over the country for childhood cancer treatment. So they come and stay with us. We run the Children's Home of Hope now. And I'm also very happy to announce that we're starting the Adult Home of Hope. And again, really largely this is due to COVID because a lot more people have lost jobs. And when lots of people have lost jobs, they tend to need to get treatment now in government sector because they're no longer covered by employee insurance or something.
Yeah.
So hospitals like HKL become extremely overloaded. And last time it used to be bad as well in terms of we used to have, maybe about 4 states or 5 states. Patient used to travel from 4 states, 5 states to come to HKL. At recent numbers, we see patients coming from about 7 states. So when they all come into places like HKL, they needed places to stay when they're staying for chemotherapy, radiotherapy, and all that. So we decided to open the Adult Home of Home as well. We're working on putting up other similar accommodation services in Penang, and we're working together for some other places all over Malaysia. So, of course, the idea is where cancer services are being provided in public hospitals, that's where probably there's a need for us to put up accommodation. So that's something that we're doing for the past 20 over years. Other than that, what do we do in terms of support? There's of course always the CIS, the Cancer Information Service, which is our 1-800 number. It's 1-800-88-1000. 1-800-88-1000. 1,000. My God.
1,000.
So yeah. So that is an online service. It's a free hotline which kind of services any questions that you may have about cancer. Patients can call, caregivers can call, any question. No question is a bad question. So unless you call to ask me where you can order KFC, because trust me, we still do get those calls as well. But other than that, we get quite a large number of people calling in to ask many different things about cancer, and our colleagues who work in that place are always very happy to answer you. We do that in 4 languages: Chinese, in Mandarin. One of the girls speaks Cantonese as well, so just in case, Tamil, English, and Bahasa Malaysia. So any queries that you have. Now, what we have strengthened over COVID and over the year as well, we've increased our psychosocial support services. So we have, and just to share, and I'm sure Maisie has told you all this, all our services are free to patients and caregivers. Yeah. So what we have is we now have dietitians, we have psychologists, we have counselors, and we have peer support counselors as well. And all this not only is available face to face. If you like us, you can come in and do it face to face. But we are also now, thanks to a grant from Yayasan Hasanah, able to do this via teleconsultation as well. So in fact, I've got the peer support group working with people in Sarawak, in Sabah. I do some sessions in Sabah and Sarawak every 2 weeks. So it's a nationwide thing. And we can do this in whatever languages, whatever queries that you have. So if you need psychological help, you need dietetics counseling, you need counseling, emotional help, everything, just reach across to us. That's something we're able to do as well. And we're very happy to do it for you. Other than this, in terms of support, is some of the good work that Maisie and her colleagues do in terms of running the support groups, where it's just a kind of posse of people who have cancer. So we've got a group of people, young people who have cancer, and them working through their problems, getting together, talking about it, and kind of finding solutions. So Maisie heads that group, which is the Young Cancer Survivors group. But similarly, we've got a group for women with cancer that's called Pink Unity. We've got a lung cancer support group. We've got a caregiver support group as well. And we've got a prostate cancer support group. So these are some of the groups that we have. So feel free to get in touch with us in case you need to kind of come together in a group and be in a support group for you to be supported throughout the journey. What we're also doing, wow. Now, after listening, Maisie, thanks, man. Now I think we're doing too much. Okay. And the last thing is this kind of wellness sessions. Wellness sessions in the sense that classes or activities that you can take up that will help with your mental health during this entire COVID thing, during this entire cancer thing. So a lot of our activities run on face-to-face as well. We've got Chinese ink painting, we've got yoga, we've got meditation, mindfulness therapy, all that's going on. But now most of it, about 80-90%, has gone online. So feel free to get in touch with our Resource Wellness Center. Again, all these is available on our website at cancer.org.my. Feel free to reach across to us and we'll connect you. Like, for example, now there's a yoga session running, I think, every couple of days once on a regular cycle for cancer survivors. And similarly, quite a lot of the activities have been taken online as well. Of course, the last thing in terms of support is we've got a lot of material available in multiple languages for you to kind of read, understand. Like, for example, one of the big things that a lot of cancer patients face is mental health issues. So things like some of the solutions, one of the big solutions that seems to work is laughter wellness therapy. Though you may laugh at it, it's no joke. So it seems to work well. So you can just go to our website. Let's download a book, an ebook that actually helps you to do basic laughter wellness therapy in your own home. Physical activity. So these are things that the resources that are available that are free for you to download as well. So yeah. Other than that, we don't do anything much.
So NCSM clearly does a lot. So for those of you who have been asking me, I share a lot about the Cancer Information Support Service. And I know some of you call up, but these are all the other services available. Of course, support groups, you can come to me. I always point you to the right direction. Like what Dr. Murali said, I hope you're saving this video so you can come back and check what he just mentioned, all of the things that he has just mentioned in terms of what NCSM does to support cancer patients, survivors, and caregivers. Last but not least, I have one last question. I know you guys have a lot of questions, so I'm going to allow Dr. Murali to take all of your questions. My last question is, in terms of recovery, what would your advice be for patients?
Okay, so in terms of so people who have already had cancer, right, and you finished treatment, like I said, the first major thing that every day you get up is there's two things that you'll get up to every day, and I'm sure Maisie will have or has shared with you over time. One is, will this bloody thing come back? Pardon my French. And the second thing is, how do I get back to normal? Right? So these are the two big things that you need to be concerned
Yeah.
about, right? Okay, so in terms of the first thing, will this bloody thing come back? Now, how do we kind of keep it from coming back? A couple of ways. First, if you're already on maintenance therapy, and quite a lot of people are now on maintenance therapy, that might be something that you need to get on. Okay, but maintenance therapy is not just a drug, it's also your physical fitness. Physical activity has a close to about 20% impact on recurrence. Okay, and so does nutrition, and so does avoidance of like how to say unsafe activity like smoking or alcohol consumption. So it's not like you finish cancer, you got to get out of jail free card lah. So these things you need to be careful about, and these are the things that will keep you from hopefully not getting cancer again, right? And the other thing that I think is crucial is these two words: the watchful wait. Always kind of keep on to your appointments. Make sure that, because nothing changes, right? Remember, like even I was telling you about being peka, you need to continuously be kind of aware of what are the changes that are going on, and kind of pick them up early, because you are always the best doctor of your own body. You'll always know the changes long before any other doctor. So this is in terms of the first part of your recovery journey, which is worrying about this thing that may or may not come back and keeping it at bay. That's the first one. And the second one is, how do I get back to life as normal? Now, as we all know, again, it's a sad reality in countries like ours in Asia that there's not much rehab programs available. People are not friendly. Employers are not friendly to kind of put you back onto job tracks. We're doing things about this. And I think that's one of my own passions, and I've done quite about it. And actually, we continue working on. Even this month, we'll be launching a new retraining program for tourism sector, which is going to be provided free for cancer patients or families of cancer patients. So where after the training, we're going to be working with some training providers. They actually can place you into jobs in hotels in Singapore. Yeah, so that's something that we're rolling out this month as well. So like I said, we're passionate about this, but I think a lot of us need to realize that it's about retraining, reskilling ourselves to do some things that we were not able to do before cancer, or some things that we are not going to be able to do again. So it's about reorientating, transforming ourselves, and moving on. And for that, you will need mental support as well, mental health support, and that's something that we are there, as well as a lot of other people. But feel free to reach across to for us to kind of keep you on track, because you need to have a healthy body, but you also need to have a healthy mind.
Healthy mind. Yeah,
Yeah.
I completely agree with that. With mental resilience and strength in your mind, especially, it can help with a lot of things
Yep.
in terms of recovery.
Yep.
Thanks a lot, Dr. Murali, for answering all of my questions. I'm gonna start taking questions now.
Okay.
Yeah,
Let's
from
do.
the
I'm getting
public.
worried, man. Looking at the number of questions
Yeah.
in the comments page. Yeah.
So so there's a question from Jackie. She, they would like to know more about experience with chemo and radio, but more of radiotherapy.
Okay. Okay. So, hi, Jackie. So, I can, of course, share with you secondhand experience, yeah, because I haven't quite got firsthand experience. But from what I understand, and this is really the critical thing about radiotherapy, yeah, a lot of your side effects or the effects that you will have are really dependent on individual to individual. So I've got patients who've got radiotherapy, not had anything, been happy all throughout. I was going to say the buggers even go to eat nasi kanda, and they seem to be happy. But then I've got patients equally who are quite ill during their radiotherapy experience. So really quite varied. It's over the term. Also, an important point is a lot of radiotherapy side effects are very connected to which area that you're getting radiotherapy on. Because radiotherapy is very targeted. They actually paint a certain area of your body with radiation, and usually that's where the cancer is. And your side effects, if any, are very related to where those areas are lah. So, for example, I know for a fact that a lot of people who have head and neck cancer, this including your nasopharyngeal cancer, when they get radiotherapy, there's a lot more kind of dizziness, headaches, vomiting. That's kind of related to radiotherapy. But people with lower GI, like stomach cancer, or your endometrial cancers, these people don't get as much when they get radiotherapy. So it's very varied lah, the experience. However, if there's a specific kind of cancer, specific kind of radiotherapy regimen that you're concerned about, Jackie, just give us a call at the 1-800 number, and then one of us will get to you, and then we can probably give you a personalized. I can report to you percentages of certain symptoms that are likely to occur in different types of radiotherapy, in different types of cancer. So that may give you a better idea of what to expect.
Okay. So thanks a lot, Dr. Murali, for answering Jackie's question. I think that helped other people who are going through radiotherapy as well. So
Yeah.
Adeline Joseph asks your comments on the COVID vaccine for cancer patients and survivors. Is it safe? What are your thoughts on it?
Okay. Good question. Thanks, Adeline. What is this? And Adeline, in case I need to promote Adeline. Adeline's the head of our Resource Wellness Center. So since you've got her online, feel free to reach across to her if you need any support activities. No. So look, coming out of COVID, right? There's a couple of things we need to be concerned about. Now, first is we know that patients on active therapy are close to about 4 times at higher risk of getting COVID compared to other people. This is including patients who have completed treatment. First issue. Now, when you do get COVID, an active cancer patient on active cancer treatment, they are much more likely to get a more serious version of COVID. So most likely to get intubated in the ICU or die. So it's not a good thing, which is why we've tried hard, I think sometimes over hard, to kind of keep cancer patients away from hospitals in which they're treating COVID. We're now seeing the backlash of that, meaning patients are not getting treatment. Different story. But okay, so now when we're talking about the COVID vaccine, okay, for patients on active treatment, I think they are going on a case-by-case basis, because really it depends on how depressed your immune system is. And again, the COVID vaccine is a vaccine. It's the same as all these other vaccines, like your influenza vaccine, which constantly people need to take from year to year, or your pneumococcal vaccine, which older adults get. Now, and the rules which are common to those vaccines apply as well, which is one, if you're on active treatment, and largely those on hematological cancers and that related set of treatment are not going to be able to get vaccinated. So that's, I think, coming off the block, that's something we already know. Now, in terms of patients who are treatment-free, and they're treatment-free for about a year or so, I think those are going to be people that we're going to look to actively vaccinate, because those are people that are, I think, still at risk, especially if they're from the older group of people, and there's still that additional risk due to the disease burden that they're carrying. So now, in terms of safety, okay, I think two things. One is the UK just released the biggest set of data. I think they've got a couple of million people vaccinated with Astra and Pfizer, and that safety data has come out. and it looks to be very, very, very safe from that data. So there's a couple of million, but don't worry, you're not the guinea pigs. A couple of million jokers have already gotten vaccinated and gotten through it. It looks to be safe at this point in time. I would actually, who now have to self promo. We just started the Medical Association just started a running series on. The safety, efficacy, and all that of the COVID vaccine on Free Malaysia today. The first edition, the first session just kicked off today, and so that I'm on that as well. So follow that, and you keep on getting Malaysian level information every day on safety and efficacy of the vaccines. So
That's
yeah.
great. So remember, check it out on Free Malaysia today, guys. Thanks a lot. I also wanted to know. So yeah, I'm gonna go take the vaccine. And Jackie has another question.
Okay.
I think their friend just recently got diagnosed. How do we get to know its existence faster and earlier in terms of cancer?
Okay.
Because
Okay.
screening for cancer in particular mostly not is not a priority even at private hospitals.
Yes, yes, and I think Jackie, you're absolutely right, and that's why I was telling you at the beginning that the messaging for World Cancer Day has been, hey, look, if you've got something wrong, I think it's no longer time to stay away; it's time to start coming back into hospitals. So. So a few things in terms of screening. So screening is very related. So screening, the word screening is really when you're well, you're trying to pick up early symptoms. And so we have to kind of deal with the idea that when you're well, people are usually lazy to go and screen and very reluctant to spend the money to go and screen as well. So that's been kind of the challenge, and I think this is a global challenge. So the idea is so in terms of screening, screen at the appropriate age, screen for the appropriate tests as well, so that it's something that it's easy to do and something that's doable for you on an annual basis. Because again, a lot of people have this idea that I screen this year, then I discount. Nothing's wrong. They get very upset that there's nothing wrong, which is another very sad information. I've got actually colleagues, colleagues, I mean patients who screen and then they're so disappointed when they find nothing's wrong. I'm like, you should be happy that there's nothing wrong, right? But they're like, no, I spent so much money and now nothing's wrong. I was like, "Gah." So it's not really a good kind of mentality to have. We're spending the money to hopefully not get any kind of cancer,
Anything. Yeah.
and yeah, and hopefully pick it up early. So that's one thing, and it kind of there's a negative feedback to it, because when you find out there's nothing wrong, right, you actually are reluctant to spend the money the next year. So yeah, so it's a mindset, Jackie, that you need to put into your mind that look, what is this? Every year I should kind of think of getting screened and get the appropriate screening,
Yes.
right?
I
And
completely agree.
yeah, appropriate screening not really expensive. The problem is everybody's kind of recommending a lot of different types of screening, and some of the screening really expensive. Of course, it may be highly effective, but the question is, do you really need it? Yeah, and then that becomes the kind of question lah. Okay, so yeah. So, yep, I think get screened, keep on screening. Also, to announce, I don't know whether you're aware that the government raised the amount of tax deductible for screening this year to 1,000 ringgit from January 2021 in the new budget. So, last year, I think you could spend only 500. Now, this year onwards, you can spend 1,000. 1,000, let me tell you, for especially if you're male, is more than enough for you to get screened for
Yes.
cancer. Yep.
Very true. I agree. So use that 1,000 tax deductible, use that wisely and go get screened. Early
Yep.
detection is always good. And Daban Dan asks, is being vegan less tendency to get cancer?
Okay, so Ben,
Daban Dan.
Dabendan. Okay.
And
Yeah, I was going to call him Ben. Yeah, but yeah. So Dabendan. I think the good thing about a vegan diet is we know for sure that the less a plant-based diet is definitely much more beneficial for preventing cancer. Okay. However, like in all things, and I think you're going to realize this. I'm not Buddhist, but I think I will espouse the words of the Buddha, which is the middle way is the best way. So a little bit of everything seems to be much better than having an absolutely vegan diet, right? But having said that, I think if you're having a plant-based diet, which is largely plant origin, I think that seems to be good. Now, what is this? Are we seeing data absolutely that vegans are getting less cancer? Too soon to tell, because as you know, there's vegan, the vegan diet per se, because there's a vegan diet, and then my wife tells me there's a vegan lifestyle as well, and this, some people may practice one or the other or both together. So we but it's really only popular about maybe about 7 8 years. So like I was saying earlier, risk reduction you only can see about 15 16 years down the road. So we so to see absolute benefits of a vegan diet for somebody who has been absolutely vegan for about 15 or 16 years, we'll see that in a couple of years. But what we do know is from data that a plant-based diet is beneficial. So going with that, vegan being a subset of like a largely plant-based diet might I mean, it's definitely going to be more helpful than not lah.
Okay, so that that is good news if you're vegan, and if you're not, maybe you can add more plants into your diet.
Yeah.
So my mother-in-law had a question. She asks, apart from awareness and education, poverty is another reason people are not going for screening. So very few government hospitals do screening, and if even if they do it, the time frame is long. And if it is cancer, the disease will have progressed by the time tests are done. What are your thoughts on this?
Yeah, I think again, I think if you notice, a lot of my work is on this. I'm actually a very big advocate of access to cancer, meaning that irrespective of how poor you are, you should have access to screening and treatment. And the society works a lot on this as well. We talked about support earlier. I think what we didn't speak about is another arm, which is called CARE, and CARE largely does this. Our care arm looks at going into small towns, small communities, and screening for cancer. So, and even now with COVID, we've been trying to get to continue doing that. But before that, all throughout the year, we actually going into very small towns all across Malaysia, and we actually screen people who've never been screened before. So and we make sure that's ongoing as well. We work together with a lot of other hospitals and all that to make this available across Malaysia. So similarly, if you come to any of our centers, any of our programs, everyone who's on a B40, as long as you're documented as a B40, if you have a welfare card or an OKU card or a B40 card, we waive all our charges. So that's always been traditionally free as well. The society also actively works with other corporate entities. For example, like Etika, we've got a big program running with Etika for a couple of years now, in which we provide free cancer screening for women all across Malaysia in terms of the B40. So these are things that many of us are doing, but of course it's never enough. So we could always do a little more, and yeah, my pet peeve is it's never enough. So we always try harder and harder.
You're already doing a good job, Dr. Murali, so don't worry. Uh, so Thomas asks your opinion on FAST,
I'm sorry.
FAST.
I'm sorry, I'm a bit blur of fast. Oh, okay. I see. Is this because Thomas asked again down there somewhere about FMD? Because I don't know what's fast, ma.
Yeah, me
Are,
too.
are you aware? Thomas, can you tell us what does fast mean? Could you maybe put a comment and then we can answer that a little better?
Yeah. So, okay, now mine, let's skip that question. Ironic asks, does diabetes make it easier? Does diabetics, do they get cancer easier or not?
Yes, yes. So unfortunately, diabetes is a risk for
Triggers,
factor.
risk
Yep,
factor.
yep. A risk factor for cancer, but so is obesity and so is physical inactivity. So and it's largely because of that diabetes is a kind of driver of cancer. So if you're diabetic, then you usually on a little bit on the fatter side as well, and your physical obesity and your inactivity are both separate drivers of cancer, and which is why kind of diabetes is as well.
Okay. So I'll take maybe three more questions for Dr. Murali because he's really busy. I'll ask another question from Thomas Yap. If you know about fasting mimicking diet plus chemo, do you know?
Oh, okay. So the FMD, okay. Now, there's the so because this the fasting mimicking diet is something that has been kind of put forward by quite a few people. And the idea is that it fasts the cells, something like intermittent fasting, and then you put it on with chemo is actually more effective. Now, I want to be careful to tell you that the theory looks nice, but so far we are unable to see big data. So theoretically, it sounds very plausible, but like a lot of things sometimes sounds very plausible theoretically, but when the evidence comes out, it's not really impactful. So similarly, I wouldn't be brave enough to make a substantive comment lah, either way. So what is this? Not a lot of oncologists are recommending this as yet, but similarly, it's because of there's not a lot of data. I know there's quite a few trials running in the US, so I think we have to wait and see. So if it is that fasting mimicking diet is something that you're able to do in the sense that during the time that you're off fasting, you're able to cover those calories and get enough nutrition so that your chemo goes well, I think it's something that you may be able to discuss with your oncologist. Okay. However, need to be aware that during chemo, any kind of reduction in nutrition is going to cause slow recovery, and delayed recovery is not going to be well. So yeah, to keep all these kind of factors in mind.
That's good advice, Dr. Murali. Audrey asks how to test for colorectal cancer from home. I like this question.
Okay, so basically, so you test for colorectal cancer using a stool sample, and in countries that I was really amazed. I was in Korea in 2018, right? And I found out that if you're Korean, if you're South Korean, North Korean, not in the discussion. What is this? So you get a post, you get a box posted to you, and there has everything. It's got a little bottle in which you send a stool sample. It's got a blood test kit where you can take your own blood, you send your urine, blah blah blah, everything, and all this gets sent out. They check for cancer. It's even got the gyne pad inside there. You can self sample for cervical cancer, and you send that out, and then you post it back. You just drop it back at the courier, and that then the results come back to you to say whether you have an abnormality or not. And that's how you do screening for colorectal cancer as well as a few other things. So we're going to try that in March. Look forward to that, and then let's see if it works. I don't know whether Post Malaysia is going to be happy with us sending shit everywhere, but yeah, we'll discuss with them very quietly on that.
Yeah. So, guys, watch out for it. March is coming up, Colorectal Cancer Month, and I'll be promoting how you can do colorectal screening from home. So, I think we'll take one last question from Marie. What animal screening do you advise to do for females?
Okay, so for females, I think there is what is this? First, okay, is cervical cancer. Second is breast cancer, and third is colorectal cancer. So these are the three big cancers that I think you can and must screen for. Now, how do I do cervical cancer screening? As I was telling you, you can either do the HPV DNA test, and then you can do it. Sorry, my camera is a bit skewed. I don't know where to point. So if you're doing cervical cancer screening, you either do a HPV DNA, which you can do 5 years once, and that's more than enough, or you can do a pap smear, and this can be done 3 years once. Now, in terms of colorectal cancer, if you've got a family history, then I would advise you to actually get screened once by doing an FOBT. Knockout blood test. It's actually something that looks at your stool, and then they pick out, they run that through, and they can pick out whether there's blood or not, and that will give you the need to actually go through a colonoscopy. So, of course, if you have a family history, and if you're loaded lah, then you go and do a colonoscopy first rather than going through the FOBT lah. Okay, so those are the two things that you can do in terms of colorectal cancer. In terms of breast cancer, one of the things that I think you should do is do your own annual monthly breast examination, and also annually do a clinical breast examination after the age of 35. I think it's of benefit to start doing either breast ultrasound if you have a family history, or if you don't have a family history, at above the age of 40, start doing mammograms.
I agree. Thanks a lot, Dr. Murali, for answering all of the questions. Wei Ching, I know you just put in the question. The answer for you is that Dr. Murali, when he mentioned about screening, which is tax deductible, it is for general screening, general cancer screening, correct?
Yep.
Okay.
Yep. It's for everything. So it includes, I think, COVID or whatever as well. But the COVID 19 screening test, I think, is only given by industry. I think PM and Liam, there's a limited amount of money which is available for existing clients. So that's really from the insurance sector. But the general wellness kind of screening, which there's really no limit to it in terms of what you can do. The government's been very general. So you can claim up to 1,000 ringgit lah.
Okay. I think Zahira had a question,
Yeah.
but I will post it to you after this because we've taken up a lot of your time.
Okay, no worries.
But
Matt, if you want to take it, I've still got.
okay,
I'll be happy to answer. Take a few more minutes if you want to.
okay. So I'll ask this one last question from Zahira.
Okay,
She said
okay.
she saw things on her timeline this week, some sort of punishment, like why do you get cancer? Do you not sedekah or what's your dosa? Two, cancer survivors stereotypes to appear strong and fighter. Why? And what are your thoughts on the impact on survivors' mental health?
Wow, wow, Zahira, you did the Malaysian thing, right? You asked one question, you asked three questions already.
I
Nakal, eh?
think I
Buy
think
one, buy one
answer
free
the
three. Eh?
yeah,
Yeah.
answer the thoughts on the impact of survivors' mental health.
Okay, okay, and I see where she's coming from, Lama. First, I think this idea that I think it's a very, very wrong idea for you to have, or for people to have, that you're getting cancer because of some sort of punishment, right? Uh, 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 and that really has an impact on the mental health. And now I understand when she's putting all those questions together,
Yeah.
because when you go into the fight or this journey of cancer treatment, if people are going to go at it like, oh, it's your fault, you must have done something wrong. I'm quite sure that'll have a very negative impact on your mental health journey. Now, you need to understand, and I think you do, as well as a lot of other people, we're now waking up to the idea that it's really no one's fault that you get cancer. It's a random single cell mutation. A lot of very, I hate to use this word, but a lot of really very good people. I mean, for me, good is very difficult to quantify. It's who's good, who's bad, but people who are seen to be very philanthropic, kind, doing a lot for society, they've had cancer as well, you know. So it's a very flawed argument. It shouldn't even be like part of the
Yes.
argument. And now
Exactly.
this is, yeah, so this is another really sad part of the story, which is 1 in 3 of all Malaysians will end up having cancer in the course of their life. So unless everybody is just that bad, uh, it's a difficult, yeah, it's a difficult discussion to have. I actually, for me, I have changed my description of cancer to those who have got cancer and those who have yet to get cancer. Yeah.
Yeah.
So you ask
I
me, yeah, I'm someone who hasn't got cancer yet, and that's about it.
I think when it comes to putting fault on the cancer patient
Yeah.
for getting cancer, I think that's a moot discussion. It
Yeah.
shouldn't even be brought up. I don't know why would someone bring it up, and it means they're not informed, they're not educated, and they don't have enough awareness of what
Yeah.
cancer really is.
So
I hope,
Zahira,
yeah,
yeah. So Zahira, if people are coming to you with this, really, I think don't ever kind of terima this thing lah.
entertain.
Don't. Yeah,
Yeah,
don't
stop
entertainment.
that.
Don't take them up as bullshit lah. It's bullshit. Don't fall for this bullshit.
Exactly.
Yeah.
I'm sorry to
And
say that, but yeah,
yeah, sorry, pardon my French. And of course, I think another thing that Zahira says is whether you always have to appear strong. I think we've had a discussion on this previously, because I think on BFM, where people talk to this idea of whether you should always be this kind of fighter of cancer. No, Lama, really. Some people take that approach that, this is a battle, we'll fight through the battle. But you're absolutely fine if you're going to kind of break down, get upset, get angry. It's absolutely fine. It's part of the entire journey. And
I agree.
I think, yeah, I think that whatever it is, I think the idea that that people like us are here for you, as well as people like Maisie and this entire group of people who have lived through this, who will be very happy to kind of support you and just sit with you and share and give you a hug and tell you that, look, we can get through this. So
Yes,
that's where the,
Ahira.
yeah.
So, thanks a lot, Dr. Murli, for answering all of the questions posed by survivors and patients and even the general audience. I will be sharing this video, so I hope you guys are to friends, family, raise cancer awareness. Join us in talking about World Cancer Day 2021. To talk about cancer and you know the things that we've talked about today are truly amazing. I feel that Dr. Murli has answered a lot of very important questions that we have posed. So thanks a lot, Dr. Murali, once again.
Always a
And
pleasure.
to those of you who join us, I have a special gift for you. I'm giving away very healthy handmade butter cookies from Lush Bowl. I'm giving 3 bottles to 3 winners. So tell me, just in the comment section, tell me a reason why you think cancer awareness is needed in Malaysia. So the question is, tell me a reason why you think cancer awareness is needed in Malaysia. So just type your reply in the comment section. This competition is open till 10 p.m. tomorrow. Then I'll DM the winners for their details. So good luck. And to those who are celebrating Chinese New Year, celebrate safely. Happy Chinese New Year to all of you. And thank you once again, Dr. Murali. This is such an amazing session. Thank
Oh,
you.
no worries. Thank you so much. Happy Chinese New Year. Have a good reunion dinner. Hope they change the SOPs tomorrow.
Yeah, I don't think
Yeah,
so, but we'll
yeah,
see.
yeah.
So, yeah, please be safe, everyone. Celebrate safely. Thank you so much once again.
Okay. Bye bye.
Bye.